will have all the pretty little horses, blacks and bays.
Postpartum depression is a moderate to severe depression in a woman after she has given birth. The mother may have the feeling of extreme sadness, indifference, or anxiety that may occur soon after the delivery or for more than a year after the postpartum period, and interferes with the normal function of the mother. Most of the time, it occurs within the first 3 months after delivery.
So as an overview, postpartum depression or PTD is a complex mix of physical, emotional, and behavioral changes that happens in some women after giving birth. The diagnosis of it is based not only on the length of time between delivery and onset, but on the severity of the depression. It is linked to chemical, social, and psychological changes that happen when having a baby. The term describes a range of physical and emotional changes that may new mothers experience. PPD can be treated with medication and counseling. So, for its signs and symptoms of postpartum depression can be hard to detect, and many women have these same symptoms of following childbirth, which includes trouble sleeping, appetite changes, severe fatigue, lower libido, and frequent mood changes. With PPD, these come along with other symptoms of major depression, which are typical after childbirth and may include being uninterested in your baby or feeling like you're not bonding with them, depressed mood, crying all the time for no reason, loss of pleasure, severe anger and crankiness, feeling of worthlessness, hopelessness, and helplessness, thoughts of death or suicide, thoughts of hurting someone else, and troubling considering of making decisions. There is no one cause of postpartum depression, but these physical and emotional issues may contribute. For example, hormones. A dramatic drop of estrogen and progesterone after you give birth may play a role, or lack of sleep. When you're sleep deprived and overwhelmed, you may have trouble handling even minor problems. Anxiety. You may be anxious about ability to care for a newborn, and self-image. You may feel less attractive, struggle with your sense of identity, or feel that you lost control over your life. So for the last time, postpartum depression may be mistaken for baby blues, but its signs and symptoms are longer and more intense. And if not treated early, it can last for months or longer. And that's the clinical manifestation of postpartum depression.
Nursing assessment for postpartum depression. First, assess the woman's psychological health even before delivery. Assess her history of illness to determine if she needs any counseling prior to her delivery to avoid postpartum depression. Also, you assist the woman in planning her daily activities such as her exercise, nutrition program, and sleep. Also, you advise the woman to take some time for herself every day so she can have a break from her regular baby care. Encourage the woman to keep in touch with her social circle, as they can also serve as a support system.
There are actually two medical management for those women who are suffering from postpartum depression. The first one is the psychotherapy and the second one is the antidepressants. The psychotherapy, also called as the talk therapy or counseling, This therapy helps by saying or talking your concerns and feelings to your psychiatrist, psychologist, or any other mental health professionals. Through this therapy, you will be able to find an easier way to cope up with your feelings, to solve problems, to set realistic goals, and also to respond in a situation in a positive way. This therapy or counseling with mental health professionals will let the woman who are suffering from postpartum depression restore its psychological health and also to share what she is experiencing or feeling about this situation. Sometimes family or relationship therapy can also be a tool in managing these kinds of situation. The second management would be the antidepressants. These antidepressants are only prescribed by your physician if you really are being diagnosed with this PPD or postpartum depression. In instance that you are breastfeeding, any medication you take will enter your breast milk. However, most antidepressants can be used during breastfeeding with little risk and side effect on your baby. But working with your doctor may help to weigh the potential risk and benefits to a specific antidepressants. Now let us proceed with the pharmacologic therapy for the postpartum depression. So in pharmacologic therapy, the treatment is being combined with the medications. Medications such as the antipsychotic medication is being given or being prescribed in order to stabilize the mood of those women who are suffering from postpartum depression. Another drug or medication is the benzodiazepines, which controls the PPD signs and the symptoms. There is also this new approved drug of FDA which is called the brexanolone, which is administered intravenously over the course of 60 hours and provide immediate relief from depressive symptoms within the 48 hours. Another one for the pharmacologic therapy is the ECT or what we call the electroconvulsive therapy. It is a procedure in which small electrical currents are passed through the brain to trigger some seizures. This is used if the PPD is already severe and if they are also experiencing postpartum psychosis. ECT is recommended when signs of symptoms of these postpartum depressions do not respond already to the previous medications. ECT seems to change brain chemistry that can reduce symptoms of psychosis and depression, especially when other treatments have been unsuccessful.
For nursing management. In nursing management, nurses must be alert in sensing the current psychological state of the patient. They must provide a precise data of the patient's well-being to give way to a more accurate care plan for a woman with postpartum depression. Under nursing management are nursing assessment, diagnosis, and its intervention. In the nursing assessment, assess the woman's psychological health even before the delivery. Assess her history illness to determine if she needs any counseling prior to her delivery to avoid postpartum depression. For the nursing diagnosis, impaired parenting related to the inability to perform activities of daily living secondary to postpartum depression. Also, the nursing intervention assist the woman in planning for her daily activities such as her nutrition program, exercise, and sleep. Recommend support groups to the woman so she can have a system where she can share her feelings. Advise the woman to take some time for herself every day so she can have a break from her regular baby care. Encourage the woman to keep in touch with her social circle as they also serve as her support system. In addition is the evaluation. The patient engaged in more social activities. The patient can express her feelings and insecurities. The patient can perform her activities of daily livings. And lastly, the patient recognizes the importance of counseling and regularly attend one. The psychological health of a mother has as much impact as well as her physical health. Her well-being must also be ensured because She is the number caregiver of the infant, and the bonding between mother and child will only be possible if both of them are in stage of good holistic health.